I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery. Welcome to our new platform, Dear Anonymous. As you know, our practice spends a lot of time and a lot of energy about educating patients. And so we thought with this new format, we could answer the patient's questions directly. And so we're going to do this every month, and I'm going to look at your questions and we're going to spend some time answering them. I think this is a good format because it'll allow other patients to see maybe what other people are asking, and also allow you to answer or to ask questions for me to answer for things that you might be thinking of.
All right, Dr. Antimarino, the first question is, what is the estimate for a basic facelift? I'm not happy with my jowls. I don't want my eyes touched, but would love to get rid of the lines above my top lip.
Well, it's hard to give somebody an estimate without seeing you. I really have to stress the consultation is really important because, number one, it allows me to get with a patient, talk about what's bothering them. I get to examine you, look at what I'm seeing, really feel the tissue, the skin, and go over things with you face to face, with you looking in the mirror, me examining you. So to just say you just need a standard facelift, you may or may not. You might need some fat grafting. You might be fine with dermal fillers and a non-surgical format. So it's really hard to say with any certainty about what you might need. So again, for anybody who's listening, this is why it's really important to do a face-to-face. At least in my practice, I really like to see patients and go over everything in detail. And then you'll meet with Tony, my patient care coordinator, and she'll go over a breakdown of everything that we talked about of getting you a fee schedule. And that's not only my fees, but also for the surgery center and the anesthesiologist. My consultations are complimentary, so it allows patients without any obligation to come in and at least talk to me face-to-face.
All right, is it possible to use liposuction to remove fat from the cheeks to reduce the look of a deep nasolabial fold and accentuate the cheekbones?
So that's kind of a hard question to answer because it sounds like there's a couple of things going on. If you have a deepening of the nasolabial fold, which is right here, that can be just because you have full cheeks, but more commonly it's because patients are in an aging age group. And so when everything kind of slides down and forward, that's where we start to lose volume in the cheeks and increase the deepness of our nasolabial fold. So sometimes that has to be fixed with either dermal fillers as a deep filler to help lift that tissue back, or a facelift. But if you do just have this excess fat in the middle of your cheek, which is called the buccal fat pad, that had become popular a few years ago. I personally don't believe in removing that tissue surgically. I think in times as you get older, that buccal fat pad becomes very important to the aging process. So when I have a patient that's interested in that, they're a little bit younger, they do not have any signs of aging, but just a real youthful fullness here, I found that our Virtue device, which is microneedling and radiofrequency, can help calm that area down so we can dissolve a little bit of that fat under different sessions. And so this can be done non-surgically, so you get a better contour, but we do allow that buccal fat pad, the bulk of it, to remain behind so that later in life, as you need it, it's still present.
Okay, can sunspots on hands be lasered away?
Yes, so that's an area that we always forget to put sunscreen. And so a lot of times you start getting the deepening of the pigments, you start getting things called seborrheic keratoses, which we used to call age spots. So there are different lasers. We have a chrome laser, which is fantastic of removing that. Sometimes more superficial age spots we can take away with the CO2 laser. But for the most part, the chrome laser done in 1 or 2 sessions can really diminish that age area on the hands.
Are facial threads safe?
That's a good question. That's a question I get asked a lot. Personally, I don't like facial threads. That has been something that has come about years ago, and when I was first out in practice, and in the best of surgical hands, they were not real successful. I don't think they last very long. I think doing it, in an office setting, I think that you're at a high risk for asymmetry. Also, patients come in and they have some scarring. I've seen multiple patients just recently that have scarring in the skin, and that really can't be fixed. We've tried different non-surgical methods for them, and it hasn't been able to be corrected. You can also have pain with them. I've seen them multiple times, when you're doing a facelift, those threads are there. I usually try to take them out. So I'm not a big fan of the threads, and I think they're just better ways of lifting the tissue. I would rather you do dermal fillers, again, maybe some laser resurfacing to help tighten the skin, but not a big fan of the facial threads.
I'm interested in a blepharoplasty, but concerned about scarring. What are the scars and how are they hidden?
Eyelid scars generally tend to heal pretty nicely. So then the upper eyelid, that scar is hidden in the crease of the eye, and they tend to heal well. Now, you can also have some areas where you can get a tiny little cyst or milia, which is a little white spot because eyelids are oily. So sometimes you can get some collection of oil in that scar. So they have to be watched, and sometimes they need to be tweaked a little bit. On the lower eyelid, usually the incision is just underneath the eyelashes, or in a crease just below that. Again, those tend to heal pretty nicely. However, they can be visible on some patients, and some patients do need some scar revisions in the future. Most of the time that can be done under local anesthesia, but those are where the most common placement of the scars for blepharoplasty.
I'm looking for some solution for my sunken eyes. I don't know if surgery or injections would be best.
Sunken eyes are common that people want to come in and talk about. Again, I'd have to take a look at your situation. Sometimes that can be because you have some excess fat underneath the eye or in the eyelid that's making that sulcus here a little bit deeper. Sometimes that's just your anatomy, and the lower part of your eyelid is sunken in, and so you have a little bit more depth there because you've got a good cheekbone. And many times you can fill that in with dermal fillers. Even a little bit of fat grafting in that area works pretty well.
Is there anything I can do about keloids?
Keloids are, yes, they're tough to treat, but yes, they can be treated. Now, again, this is a situation where there's confusion about a thickened scar and a keloid scar. They are two different types of scars. I have patients that come in, and if it's a scar they don't like, they always refer to it as a keloid. Some scars heal where they're just a little bit thick, but it's along the previous scar. So the initial injury, whether it's an incision where that scar can be a little bit thick, yes, that can be treated. That's called a hypertrophic or thickened scar. A lot of times injecting steroid like Keloids into that scar as it is healing can help soften that. Microneedling radiofrequency works well, even just microneedling alone. But a keloid is something different. A keloid is a very thick scar, and think about a keloid as a scar that has grown outside the boundaries of the initial injury. The one that I use, the example I use a lot is when you see patients that have had their ears pierced, where that's that tiny little hole, but the scar is very thick. So it's outside the parameters of the initial injury. So that patients will think of, as a keloid or even a hypertrophic scar. They look similar, but underneath a microscope, they're a little bit different. So you treat a keloid scar, again, a lot of times you start injecting it as it's forming with some type of a steroid like Keloids, get that scar to soften, and then you can actually excise them. But once you excise them, they're going to want to tend to come back. So you have to be on it very quickly. When you start to see that area thicken, you need to start injecting that every month with that Keloids or another type of steroid to help soften that. At some point, that scar will soften and fade away, but you have to be on keloids. It's not something you can excise and walk away from. You have to be, as a surgeon, you have to be on that all the time. It might take a year or two to finally get that patient to where that scarring shuts off. I've
been seeing a lot online lately about lip flips. Do they work, and what are the cons?
Lip flips are still pretty popular, and that's when you add just a little bit of Botox to the upper part of the lip to help pull that lip up a little bit, and that kind of shows a little bit more of the pink of your lip. It works pretty well. The downside is it doesn't last very long. You don't use a lot of Botox, and that muscle around the mouth is a strong muscle, which we use every day. So the Botox seems to wear off quickly. And I use Botox as a general name for any neurotoxin. So I think it works well, but also I think dermal fillers in the lip can help build up that pink part of the lip and give you a little bit more fullness. So, and that tends to last longer than the neurotoxin.
And what are my options for addressing a double chin? Should I get a chin implant?
So again, sometimes patients have a weakened chin, so they don't have enough projection of the chin. And sometimes it looks like a double chin because they have fullness here, and we see that a lot. In my experience, it's more about the fullness underneath the chin that causes that double chin look, more so than just the recessive chin. So for me, I think liposuction in this area works very well. I have a lipo AI device that I actually do in my office, which is laser lipo. I do it under just local anesthetic. And you actually make just a tiny incision underneath the chin and go all the way back to the jawline, all the way down onto the neck, and all the way out to the other end of the jawline. And you can really contour that area and give you a much better contour, and that can help that chin look more cut here, more defined, and give it a little bit more prominence to the chin itself. I haven't done chin implants for a while. I think there's some issues with those. I wasn't ever really sold on the idea. They can tend to move and they can cause pain. What I've done in the past is actually do some fat grafting or even dermal fillers into the chin area just to give another few millimeters of projection. But I would rather do that personally than put in a chin implant.
Well, thank you, Dr. Antimarino, for finishing our first episode of Dear Anonymous. The link to the form will be in the caption, so if someone wants to ask questions for next month, please feel free to leave your questions there. Is there anything else you'd like to add?
I would just thank you for being a part of it, and I hope this becomes very popular with everybody. It's always fun to see the questions that are coming in. It's something that we can address. Again, this is really just to be educational to anybody out there with questions, so I hope you participate.